think one of the most important things that people should know about the vaccines is to not be afraid of the vaccines. The vaccines are tested for safety and efficacy in tens of thousands of people. And during the clinical trials, an independent data and safety monitoring board, they did not find any serious safety concerns with either the Pfizer or Moderna vaccine. It's something that's still being studied right now. We don't have all the answers. However, what I've read currently is that the vaccine should still work and still provide some immunity to these variants. The most common symptom is some arm soreness. However, there may be other symptoms such as headache, fatigue, muscle aches, joint aches, and sometimes fevers and chills also. However, these are all symptoms that are very common from receiving vaccines in general. If you've already had COVID, it's still recommended that you take the vaccine. And the reason is because it's not very clear about how long immunity after getting the virus and recovering lasts. If you're currently infected or in quarantine, it's recommended not to take the vaccine until you have recovered and you're out of isolation. If you have anaphylaxis or severe allergic reactions to any component of the vaccine, then you should not take the vaccine. If you have allergies such as food allergies or allergies to pollen, oral medication, or pets, these patients may still receive the vaccine. They just have to be monitored for 15 minutes. If you were vaccinated and you do happen to contract COVID, your symptoms might be less, or you could be asymptomatic. And if that's the case, there's still a possibility you could transmit that to other people. So again, it's very important to continue to wear your mask and practice social distancing. Initially, a lot of the organizations were saying 70%, but more recently I've heard numbers even higher than that as well, going up to 80 or more % of people needing to be vaccinated. We know that vaccines save lives, and we know that vaccines are an important tool that we have to combat this pandemic, and it's a chance that we have of one day returning back to normal.